of Grace Episcopal Church, where each night our neighbors who are without a permanent home find shelter, where on a weekly basis our neighbors who are hungry come for the food pantry. Standing here across the street from the Capitol, where in 2009 Dwayne Benjamin Warren, homeless and without medical insurance, died from sepsis at age 38. Standing here today in the shadow of this church and this Capitol serves as a reminder that, in Coffin's words, the richest country in the world still denies fundamental rights to its poorest citizens. And the numbers of those living in poverty or on the edge of poverty has increased, fueled in part by the number of individuals and families thrust into bankruptcy because of medical bills, even when they had insurance. The numbers of individuals and families who cannot find affordable medical insurance has increased, resulting in medical bills that have cost them their homes, their savings, and their retirement. This is not acceptable, and the governor and the legislature can do something to alleviate this suffering. Standing here today as people of faith, we know that we are called upon to care for one another and to heal the sick. Standing here today, we know that insurance companies and their executives continue to make huge profits, profits that are the result of increasing premiums, increasing co-pays, and decreasing coverage. The Patient Protection and Affordable Care Act seeks to address some of these iniquities. Our governor and legislature have the obligation and ability to, but perhaps not the political will, to improve the lives of thousands of our neighbors here in Wisconsin by implementing the portions of the Affordable Care Act that call for the creation of a statewide exchange and for the expansion of Medicaid. The creation of the exchanges and the expansion of Medicaid will increase access to medical insurance and therefore medical care and treatment to thousands of our brothers and sisters. A few weeks ago, the governor wrote an op-ed piece for the Washington Post that was critical of the Affordable Care Act. Unfortunately, his op-ed left out most of the facts about what the Affordable Care Act means for Wisconsin. The actuarial report that the governor selectively cited in his op-ed found that Wisconsinites who purchase insurance on their own will receive $729 million in federal tax credits and subsidies that will make insurance more affordable for them. It found that 41% of individuals will receive significant premium reductions, and 47% of Wisconsin's small employers will see their premiums reduced by an average of 16%. The governor also failed to mention in his report, or op-ed, that Wisconsin will receive an increase in federal funding to help reduce the number of uninsured Wisconsinites by 340,000. For people of faith, health care is a moral issue that greed has turned into a political issue. For people of faith, health care is a theological issue that selfishness has turned into an ideological issue. This is an issue that, as people of faith, we must recognize as part of our call to work for the common good. The Reverend Dr. Martin Luther King Jr. said, "Of all the forms of inequality, injustice in health care is the most shocking and inhumane." Today, as people of faith, we come together to demand that the governor and legislature fulfill their responsibility to all the citizens of Wisconsin and implement the requirements of the Affordable Care Act. We come together to demand that the governor and the legislature follow the law. We don't think it's too much to ask, and we know that it's the right thing to do.
Thank you so much. Thank you all so much. If you all bear with us for a few minutes of just a little bit of logistical things, and we are all going to walk over and deliver the petition and people's statements to the governor and to the leadership of the Senate and Assembly. Just give us a couple minutes to get organized. Thank you.